Everyone, it's Trans Cat Dad, and I wanted to make a little informal video, and I got a little microphone now, so now I can turn on my phone and say whatever I want without torturing y'all with shitty audio quality. This is Dumpling, by the way. She seems to be scared of the microphone, so I won't be showing it to her again. I think some of the chickens in there are kind of jealous that she's out here. They also want my attention, so I don't know if the mic's gonna pick it up or not. I hope they aren't too mad. I feel sorry for them, you know? Well, anyway, I saw this Reddit post, and it made me want to start talking, because, you know, I'll start typing, and I'm like, there's just too much to explain. And so here we are. There was this Reddit post on one of those transmasculine subs, one of the many that I'm on, and I saw this guy, and he's like, is there an alternative to saying AFAB? You know, because, like, it makes me dysphoric, you know? Like, can I say something else? Because, you know, sometimes I gotta talk about, like, the situation of my body, and I just feel like it's not quite right. And I'm like, you know why it doesn't seem quite right is because it's not, you know? And, let me tell you why. She's so into that grass. I love her. So yummy. You know, whenever you get a farm fresh egg and you're like, wow, why is it so orange? Why is the yolk so vivid? It's because if they eat a lot of grass has, how do you say it? Carotenoids? Know what I'm talking about? And if they eat enough of it, then it changes the, you know, it's the same shit that turns carrots, hence the name, orange, okay? You know, really, now I want to look at the yolk side by side with the carrot, similar color. Anyway, so is there an alternative to saying AMAB or AFAB? Of course there is, and I don't know if y'all know this, but trans people used to broadly, to my understanding, use the acronyms CFAB and CMAB, which, you know, you're like, what is that? You might already know. But what is the C? It stands for coercive. So yeah, we're not gonna add the A. We don't have to add the A. But, you know, like CFAB, coercively assigned female at birth. Why is that important? What's going on here, right? The first one is acknowledging socially what's going on whenever somebody is assigned. Okay, because whenever we use, you'd think it's kind of implied in the word assigned, but because I guess we don't have the word coercive, people have forgotten that being assigned is something that a person does to you. Okay, whenever you're assigned a gender at birth, who is doing it to you? Because it's not just a fact of nature. Okay, what's happening is that your medical team, your doctor, looks at your external genitalia and says, you know what, this dick is too small, I'm calling it a femoid, is what happens. That's the reality of the situation. Isn't that right, Dumpling? What do you have to say? Yeah. You're not so scared of the mic anymore, are you? She's a little scared. So why is this important? Why is this this distinction in the language important? Or like, how is it useful? I could imagine some people being out there and saying, oh, this is a distinction without a difference, and there's a significant difference here. Leaving out the word coercion, like I was mentioning earlier, I think a lot of people just, again, act like it's a fact of nature to be AMAB or AFAB, and like totally excluding the social element of the situation, which is that somebody has done this to you. A group of doctors have done this to you, and your parents, depending on your parental situation, which of course is there's a variety of parental situations out there. I'm no stranger to this conversation, but regardless, usually what typically happens with people is that even before they're born, a great deal of decisions are already being made for them regarding their gender identity or their prospective gender identity. And y'all are already familiar with this. I know a lot of y'all are going to say, What about those goddamn forest fires that were started a couple of years ago, broadly over the U.S. in particular, because of all these baby showers with pyrotechnics or just fireworks being shot off by these people who are really excited to broadcast the genitalia of their babies to the whole world, you know? Which I don't even have to put that much stink on it to tell you I really hate it. I really hate that shit. But yeah, so let me tell you a little story, okay? There's something that's bothering me a little bit lately, which is that I feel like trans people and intersex people, you know, broadly queer people, because let's say we have like the LGBTQIA plus, okay? We got a big acronym, and we have a big acronym for a reason, and it's because we are deemed freaks and outsiders by the cis normative. Really, I think it's better to just go ahead and call it like cis supremacist society that we live in, right? We do not belong, and we are treated like we do not belong. And so we find our natural allies, other, you know, even cis gay people, especially before now, were perceived to have been committing a great, I don't know, like a social misdeed, by denying their gender assignment functionally. So what happens with gay people, and of course there are a lot of analyses of homophobia out there, and this is not the end all be all. I will remind you that I do happen to be not just trans but gay. Some, and also all gay people are different, and some of us are dumb and bad and have dumb and bad ideas. My idea is not dumb and bad, but and I'll prove it to you by telling you what it is right now. Basically, gay people were thought of in a way that was a little bit more similar to how trans people are thought of now, which is, you know, you're doing something unnatural, which is when you're assigned a gender, it's a kind of a packaged deal. You know, you pop out of your mom, which again, I'm doing the cis normativity right now just by saying that, you might notice. You pop out, you are born, and then they look at your genitals, they say, let's look at the length of that clit and decide if it's a clit or a dick. And then we are going to base your entire future around this information, okay? And, you know, personally, I do kind of find it coercive that you can be a one-day-old baby and all of these decisions are made for you already. What kind of job can you have? What kind of person can you marry? You know? Like I said, it's a package deal, and that package deal, especially in the past and depending on where you live, and of course it is still like this now. It's not like homophobia is over, okay? It's not over. I would consider it coercive. I think coercion is a great word to describe what's going on here. What often happens in these sort of like micro social situations, the family unit, which is, you know, not just a social unit but an economic unit as well, that most people are completely, especially as a child, you are socially and economically dependent on this unit caretaking for you, sheltering you, feeding you, etc. And also providing a psychological and emotional place where you may exist without challenges, let's say. So, and of course for a great deal of queer people, this does not exist. Oh, I forgot one very important part of what the list that I just made. So in that socioeconomic package of protection that you are supposed to get from your family, one thing also is medical. It's not just nutrition. It's also medical care appropriate for your body, not just your body, but your identity. You know, and these are things, of course, that are broadly denied to queer children. Queer teenagers, you might understand, are at a very, very much increased risk for homelessness when compared with, you know, people of similar demographics who are cis and straight. If you work at a shelter for homeless kids, you are going to interact with a lot of trans kids. I'm sorry to say, but that's the reality. I've talked about this before. But okay, so we're talking about CMAB and CFAB. Like, why would we want to use these terms? And like, what exactly do they mean? I think something that's very important to me personally is that these are they're very binary terms. They're only binary terms. That's the only way to think of them. They are still very, not just cisnormative, but gosh, I think I'm having a failure of language where I really wish that I would have been on the computer right now, because I'm certain that there is language for this. Oh gosh, and I just don't have it. And one of my points of this video is that trans people and intersex people, aside from the entire LGBTQIA plus spectrum, we make natural allies because of the rejection that we face, and I think that a lot of trans people, especially right now, are failing our intersex comrades, our intersex community members, by failing to understand the, I guess, like, the usage and kind of, like, complexity of the terms AMAB and AFAB, which, like, I think that we're just kind of doing what cis people do. When we use AFAB and AMAB to describe an imagined ideal body, it's really, like, it's not just a failure of language, but it's also, it sucks, you guys. Okay, let me tell you a little story. You might not have a very good understanding of intersex people. I'm not intersex. I'm dyadic. I know that there are a few different terms that people use to basically say that they are non-intersex. Dyadic is one that I am familiar with and I usually tend to use. So being a dyadic person, there are lots of things about intersex people that I didn't know unless I, made like an intentional effort to go and find out, which I completely, very much encourage you to do, considering that as a trans person, you deal with a lot of the same shit that intersex people do. We deal with different things, but we also deal with similar things, like with cis gay people as well. This is who we are. We're a community because we deal with a lot of the same shit. Anyway, you already get that. Dumpling, do you need a tomato? Alright, we're gonna do a little tomato break. Dumpling, watch the camera, okay? Don't freak out when you see yourself. You know what? You kind of look like you're freaking out. You kind of look like you're freaking out a little bit. It's okay. You know what? We're gonna go get the tomato. And I am actually just showing off my garden. You might be like, oh, Oliver, you gotta be more careful. Like, there's like, Rainbolt's gonna figure out where you live. And it's like, well, maybe he will. I'm not that worried about it, actually. Oh, microphone's far away. I'm being a doofus. Okay, actually, I want y'all to be able to see this. Dumpling is really excited about the tomato. Alright, Dumpling. How are we gonna do this? Girl. Real? Okay, well, I guess she doesn't want the tomato. So, what the hell was I saying? Intersex people and trans people deal with a whole lot of the same goddamn bullshit. And I think as a trans person, you kind of owe it to intersex people to fucking pay attention to what the hell they are dealing with. And, I didn't know what that noise was, it scared me. And so, like, let me give you a little bit example of the failure of language that is the terms AMAB and AFAB. There's a few years ago, I read an article about this man who thought that he was, as far as he knew, he probably didn't even know the word intersex. To my understanding, he was just like a cis straight man. And then he went to the doctor because he's like, what the hell's going on? I have all these tummy cramps lately. And like my doctor, nobody could figure out what the tummy cramps are. I believe that they discovered with an ultrasound, could have been a different diagnostic tool. But anyway, he had ovaries. And I believe that he ended up getting an oophorectomy, removing that ovary tissue. And I would assume also that the tummy cramps were solved after that. Again, I'd have to really look up the details to find out for sure. But anyway, you have Google, you're on the internet, you can find it. I believe in you. And basically, what I'm trying to tell you is, I want you to go ahead and try. What are you gonna call this guy? Are you gonna call him AMAB or AFAB? Okay, it's taken me 16 minutes to ask you this question. And so it's a really important question. Are you going to call him AMAB or AFAB? Because apparently those are the options. Those are the two options you get to accurately describe somebody's body. There's a lot of people out there who will say, they will use the term AFAB, and what they mean, maybe what they mean is somebody who can get pregnant. But that's not all people who were assigned female at birth. Some people say AMAB, and what they mean is people who have a dick. And it's like, well, there were some people who were assigned female at birth who have a dick. So, I don't think that's necessarily very accurate or useful language. It's not accurate and it's not useful language. I've seen doctors' offices where, like, you're checking off the box on your intake form before your appointment, and like they will ask you because they're trying to be like culturally competent for their trans patients, and I really appreciate the effort. I in a way I kind of feel bad for them because they probably hear about shit like this and they're just like pissed. They're like, I'll never be enough for you. And it's true, and that's actually a good thing. I think we should always be striving for better and better, of course. But the reality is that, like, AFAB does not tell you fuck all about my body. Like that example of that man that I was telling you about. If you called him AMAB, what the hell does that mean? What does that actually tell you about his body? I don't think it necessarily tells you a whole lot of useful information. I mean, that guy had no fucking idea he had ovaries until he was in like his 30s or 40s, So, apologies for being repetitive and belaboring this point, but I think it is more useful to use coercively assigned female at birth and coercively assigned male at birth. I think that these terms are more useful. You might be asking, well, gosh, Oliver, like, how am I going to describe in one short, cheeky little acronym, like, how am I going to say, well, I went through estrogenic puberty and I was born with a vagina and I was also born with the uterus and 2 ovaries and I grew boobies and I didn't take any puberty suppressing medications when I was a teenager, and I started having periods when I was 13, and I had one pregnancy. Is like, how am I gonna describe all of these things without a goddamn paragraph? And it's like, well, nobody asked you to, and it's not medically useful to try to wrap it up in one sentence, in one acronym. Okay, it's also not. I don't know, guys. It's not cool. It's not cool. AMAB and AFAB are complete failures of language, and I think that we just shouldn't use them at all, ever. And that's how I feel about that. You know, if you're saying like, hey, are you AMAB or AFAB? It's like, what do you want to know? What do you actually want to know? Because if you're trying to ask, do you have a pussy? Then fucking just ask that. You know, like, don't. I think Americans in particular, like the English-speaking Western world, from my standpoint of the language that I speak natively and what I've noticed in the way that people talk about their bodies and try to be polite, I guess, like the social custom, I guess, is what I'm trying to get at here. Is there's in my country, nudity and talk of anatomy is like uncouth. It's very crude. You're not supposed to say vagina. You're not supposed to. The only people who are supposed to say vagina are gynecologists or women comedians who conservatives really don't like. You know, those are the only people who can say it. And when they do say it, they are going to be really mad. You know, even if you are a doctor, even if you are a gynecologist, they're going to be grossed out, you know, particularly if we're talking about any kind of gynecologically aligned anatomy. And you know what? There's a word you could use right there. Oh, what could I say instead of AFAB? You know, if I'm trying to talk about something, gynecologically relevant anatomy? I don't know. Is that really that hard to say? I don't know. Start practicing. You can practice. You can say words. You're good at this. You know, I don't even talk that much. Except when I turn on the camera to talk to myself, but I don't necessarily get tongue twisted, and even if I do, it's all right. You know, be creative. Language is creative, and I think that's beautiful. So, you know, like, what did we learn here today? Like, how are we gonna wrap this up? So, basically, you know, I am not AFAB. I was AFAB. Okay? And what I mean by that, I really want to be specific about what I mean here, because I know some of you already know this. Some of you, this is the first time you've heard this in your life, so I gotta explain it for those people, okay? When I say that I was AFAB, what I'm saying is that I was assigned by a doctor, female, on my legal record, on my birth certificate when I was a baby. That is what happened to me, past tense. It is something that happened 30 something years ago, and it's no longer relevant to my health information that it used to say female on my birth certificate. It doesn't even say that anymore. It doesn't say that anymore. I was coercively assigned female at birth. I was forced to live as a girl and forced to live as a woman when I was young, against my will. I had no choice. You know, if I had disobeyed this order that I was coercively assigned, then I would have ended up like so many queer people before me, so many trans kids before me, homeless, institutionalized, put in a hospital long term. My parents were Catholic and they're fucking Trump supporters, dude. Like, I think that the word coercion here is very important to acknowledge, and it kind of drives me a little bit insane that we've dropped the C. You know, sounding a little bit like LGB dropped the T, you know what I'm saying? It's a little fucked up. It's a lot fucked up. You know, bring the C back into the acronym. And you know what? I think I'm going to start doing that. And it's also like, you know, let me reiterate here. It's not that I am CFAB. It's that I was CFAB. Does that make sense? Are y'all picking up what I'm putting down? Is this like registering? Because, yeah, again, I think this language is more useful. I think it paints a picture of trans history, like personal trans histories and intersex histories that are more relevant and more useful and more, like, accurate and understandable than AFAB. which really, AFAB, like, y'all know what it is. AFAB is just female by another word, which, like, there are problems with the word female. Like, who is and who is not included in female? Like, in my opinion, in my transgendered opinion, okay, I would not use the word female to describe me, and I think it would be really unusual. I think it would be inappropriate and honestly, like, offensive to use that language to describe me, you know? I could understand somebody saying, like, I don't know, man, whenever I'm in my garden, I'll go over and I'm, like, looking for the female flowers and the male flowers, because they don't care, you know? It's like, it's fine, okay? You talking about dogs? That's fine. You talking about chickens? That's fine. 2 of my chickens lay eggs, and I named them Harry and Kim. He, him. Yes, from Disco Elysium. And they don't seem to mind that I call them that, to be perfectly honest with you. If they don't like it, I don't know. As far as I've been able to tell, I don't think that chickens have gender identities. You know? Oh, sorry, did I show you a close-up of a poo-poo? I'm really sorry for showing you that. I hope you... I'm so sorry. I'm so sorry. That's just part of having chickens, you know? They're always pooping. Yep, so... gender is social. Did you know that? I just think, I think that if we talk about gender in a way that is more material, I guess, I think that it's more, I don't know. It's liberatory. And I think that trans liberation is important. Hot take. That's my hot take of the day. I think that the language AFAB and AMAB are, like, extremely cis-normative and, like, honestly, like, cis-supremacist, and I think that it's not useful language. It's not medically accurate language. It's also very containing. It's very exclusionary. It excludes people who have experiences that are, you know, maybe identities that people would call intersex, or maybe something that people wouldn't call intersex and might call something else, you know, because there's a lot of different words to explain a lot of different things that happen to be people's happenstances. There's a lot of different people and a lot of different bodies out there, you know what I mean? And yeah, you know, my final thing I'm gonna say about this is, again, I think that, and, like, I'm a dyadic person saying this, and anybody who's intersex watching this is gonna be like, yeah, no shit, dude, obviously, but it's a big goddamn problem that anybody who is interested in advocating for trans people are so often, like, fucking overlooking intersex issues, okay? And, like, intersex people. You know that a lot of intersex people are trans, right? You know that y'all drive me insane. Every single one of you. If I ever want to go insane, which I guess I do, because all I gotta do is go on reddit.com and go in the transgendered subs. And I'm like, what's wrong with you people? What's wrong with you people? That's actually why I deleted Tumblr as well. Don't look at my Tumblr. Honestly, I need to, like, delete it. You know what? I think I will do that, probably. I don't know. I got commitment issues. Dumpling is eating a lot of grass, and I'm gonna go put her back in the coop, okay? She needs to go back with her friends. Her friends are all fucking jealous that she's been out here for 30 minutes. So, it's over. That's that. It's getting dark outside. It's outside. It's chicken bedtime. Chicken bedtime, okay? Okay. Got that? Now start fucking, like actually learn about intersex people. Okay? And stop being a moron on Reddit and making me make videos. Shit's annoying, okay? Yep. Alright, bye.